When I was in junior high, I remember sitting in an anatomy class and just being absolutely blown away by human anatomy and thinking, whatever I do with my life, I want it to be something to do with this. I knew I wanted to do something where I was active, where I was using my hands, where I was physically doing things, and surgery really just lined up with that. So when I first was applying to medical schools, it was always my hope to be able to go back and serve the town that I grew up in a small town in central Minnesota. And so when I was applying to programs, I was looking for programs in similar areas. Had a lot of interviews at larger academic type settings, more urban type hospitals, and then a handful of community hospitals. But ultimately, when I went to rank programs, I ranked Marshfield high because I knew that it fit most closely with my goals as becoming a rural general surgeon, and I had seen their track record of training rural general surgeons. So on a typical day, I usually am waking up around 5 o'clock, usually at the hospital by 6. We have conference every morning from 7 to 8, so before 7 o'clock we have to round and see all of our patients. Because we are a smaller program, our conferences are very interactive, very stimulating conversation. We also have simulation lab that we go to a couple days a month where we get to practice colonoscopies and EGD on our GI trainer, as well as laparoscopic training. After conference at 8 o'clock, that's when our surgeries usually start, so most of us are going to the operating room and then rounding with our attendings in between cases. I would say I am in the operating room almost every day. Just 2 days ago I had 4 surgeries. Yesterday I had 1. After our surgeries are done for the day, sometimes they extend late into the night often, but typically we're out of the hospital by 5:30, 6 o'clock. And for me, what that looks like then is I drive my 2 minutes home, I have dinner with my family, I try not to take any of my workout until my kids are asleep, and then I take my computer out and I'm usually starting preparing for the next day or finishing up notes from the previous day. My hope and goal has always been to do rural general surgery, specifically in a small town, for the reason of having a broad scope of practice. At more academic hospitals, there's not really a role for a general surgeon because of all the subspecialties, but at community type hospitals, a general surgeon gets to do a lot more as far as scope of practice. And that was really appealing to me and part of the reason that I chose Marshfield. Marshfield has a reputation of training and then sending out general surgeons to work in smaller communities, making us confident in our surgical skills so that by the time we're interviewing for jobs, we feel like we do have the skills and the ability to go actually work right away. So one of the benefits of training at a rural surgical residency that I've found so far is our early and frequent operative experience. Because we are a smaller group, we do get into the operating room more frequently. I am just finishing up year 2, and I believe I have almost 500 cases logged at this point. Some of those are minor cases, some of those are a little bit more major cases. Here at Marshfield, I feel like we do have a lot of autonomy in the operating room. We are doing major operations that a lot of 3rd, 4th year, even chief residents are doing at other locations. So one of the things that I really appreciated this first couple of years too is just our early robotic training. We have a simulator in one of our ORs, and so we can get our robotic training done right away. I had mine completed within the first couple months and was actually able to sit on the console and operate during my first year, which I think is extremely rare. We have a really great group of attendings here at Marshfield. Because we're a small group and there's only 15 of us, our attendings all know us very well and we know them very well. So it's easy for us to build rapport with them. When we've done a surgery with them, they remember kind of where we're at in our skills and are able to help us progress. The other thing that I've really enjoyed in the last 2 years is getting to know my co-residents. Because there's only 15 of us, we all have become very close. We depend on each other and we hang out a lot outside of work. So since moving to Marshfield, our family has really thrived. My wife grew up outside of Seattle in a huge city. She was very hesitant moving here, what it was going to be like, and was very nervous. We've been here for 2 years now, and she absolutely loves it and couldn't picture our family being anywhere else. So some of my favorite things to do when I'm not at work are hunting, fishing, skiing. I grew up ski racing, just being outdoors in general. It's one of my favorite things to do with my kids. Being in a small town, lots of other additional perks. My drive to work every day is like 2 minutes. I could walk here if I needed to. And so that's all saved time that I'm not driving, that I can be with my family. So practicing surgery in a rural location, I feel like is extremely important because there are so many rural areas in the U.S. Our catchment area for Marshfield Clinic extends all the way to Lake Michigan on the east, to Lake Superior on the north, and then all the way over to the border of Minnesota. So we have a huge catchment area and are a real critical piece of serving those communities. If we weren't there, they would be hours away from their closest hospital. And a lot of times emergencies can't wait hours. They have to be handled in a matter of minutes.